Hey, it's Ryan Gray. Today I want to talk about toe walking. Now, this is one of the most common concerns that comes up throughout the course of the school year for me. Every so often there's a parent or a teacher or a principal that comes up and says they've noticed that their kid is walking on their toes. And they're wondering if physical therapy might be able to help. Now, as a school-based physical therapist, my first question then becomes, now, does this toe walking, does it affect their function in school? Okay, does it affect their ability to receive an education or to access their curriculum? If so, then physical therapy might be beneficial. Now, there are a whole bunch of causes for toe walking. Probably the most common is idiopathic toe walking, which means that there is no known underlying condition. Now, sometimes toe walking can be because of cerebral palsy, it can be linked to autism, but with idiopathic toe walking, there is no known reason. So it can be harder to treat. Now, one of the main things that we are learning in treating toe walking is that the sooner you start, the better. It is so much easier to help a younger kid to fix bad habits than it is an older kid. Now, a lot of times I start working with kids in like second, third, fourth grade that have toe walking, and by that time, it's really hard to make a difference. By that time, a lot of times we're looking at more intense treatment, medical treatment, such as casting, bracing, night splints, even surgery, because by that point, a lot of times the muscles and tendons have grown too short, even for stretching. So you're looking at more of a surgical and medical management rather than just physical therapy. So when I'm working with a kid that's toe walking, some of the things I look for are their gait quality. I look to see if there's anything we can fix with their walking to make it more normal. Also just their strength, even core strength, the hips, all the way down through the legs and the ankles. If there's weakness there, that can also contribute to toe walking. And if there's any stretching that can be done, that also can be beneficial, but a lot of times it's not as helpful as we like to think it is, just stretching by itself. So the best thing I can tell you is that if you have a question about a student that's toe walking, come to me or one of the other physical therapists and let us take a look. And we want to do it sooner rather than later. The younger they are, the better, so that we can make the correct treatment plan for them and get them the help that they need, so that hopefully it doesn't become as much of an issue down the road. Okay, thank you. I'll see you next video.